This is Smile Business Diary, a DSD podcast. Welcome, Dr. Raquel Reis. It's a pleasure to have you on the Small Business Podcast. How are you?
Oh, I'm great. I'm so happy to be here with you, Maria, today. And I'm very honored to have this conversation with you.
Well, thank you. The honor is mine. I've known you for a little bit. But for those that are listening who don't know you, I want to start out by just giving you the floor to explain who you are as a person, as a dentist, and what your practice is like right now.
Yes, I am from Brazil. I started dentistry here many years ago. I came to study actually just for continuing education, and then I decided to go for the boards. What was very challenging for me was the language too, that I wasn't fluent in English at the time. So it gave me a lot of barriers to proceed. Um, Lately, I am a DSD clinic, like you said, what is really a game changer in my life. It's really, it's my workflow is completely different. We deal with patients differently. And I'm so happy that I went through the coaching with you guys. Um, we work in a professional building. It's like a family practice, dental and medical building. I worked with my husband for many years. He's a physician on the same building. What makes it really interesting too, because we kind of share knowledge to each other, like he teaches me things, I teach him things, and it works pretty good because that's a lack in medical field. There's a lack in medical field related with dentistry.
Right.
People don't understand too much about.
Yeah.
And everything's integrated, everything's the overall of the everything. Yeah, it's holistic. And he tells me a lot of stories saying, like, this patient came, Raquel, he came from an emergency. He had spent a lot of money already. He is completely lost, tired of looking for help. And I ended up looking at his mouth, and it was just a tooth that was with an abscess. And they took all kinds of x-rays, and he spent too much money for no reason. So there's a lot of misunderstanding on the medical field too,
Right.
And then I get good referrals from him too, because we work with a medical. He's affiliated with the hospital that I work for many years. I've been sharing office with him. And for me, it was convenient too, because I always consult with him when I see the patients that he knows. And it's always good to know the overall health of the patient when you start doing procedures, So I try to do my comprehensive dentistry, it's taking care of the patient, listening to the patients, being very with good relationship with the patient, because that's what makes you different,
Yeah, absolutely. And you're based in Chicago, right?
Yeah, I am in Chicago. Yes, I'm the
Yeah.
first Brazilian female dentist in Chicago.
Yes.
So I was honored actually with that too. I got an award from my community in New York in 2022. I was very happy that I got that award too.
Yeah.
So I've been helping this community for such a long time. There's a lot of emergency people that come from Brazil to study just for a few days, and they get in trouble. So I'm an emergency dentist pretty much. It's right. It's all the time, a lot of emergencies. So
that's a lot to fit in.
Yes.
You're also doing comprehensive dentistry and
Yeah.
very involved with DSD. So that's interesting.
Yeah, but
thank
like I
you
said,
for
I'm changing my approach lately with DSD. So things are completely different. Oh my God, it's completely different from before.
Yeah. Let's talk about how you started, because you're Brazilian. You came to the country fresh, fresh immigrant looking for the American dream. What was that like for you? You know, I know it's challenging. I talk to a lot of immigrant dentists that come to the States and try to build their own practice, but you've done it before most. So how did that work out for you?
Wow. That was the biggest challenge that I had was to take out to be able to go for the boards. At the time, there was no computers, no cell,
Right.
no Google, no. So you had to study in tapes. So you would study the whole day in tapes for the boards and the English, the TOEFL. So I went through Kaplan University, and I spent there a year almost to study for all the national
That's
boards, the tests. And then I was lucky to get involved, get us accepted at Northwestern University, a dental school that was in Chicago before. Now they closed, unfortunately. That was one of the best schools in America. And now they're just medical. And then they evaluate my curriculum, and I took some extra classes. I went through the residency program there for about 2 years and a half, and actually I did it really fast because I see people that cannot make it.
Mhm.
I finished in about 3 years with paperwork and everything, and I got really excited with my new clinic. I opened my own clinic
Right
in
away.
Chicago right away.
Wow.
My husband helped me a lot. He was already a physician here, so
I see.
he had his location, so we always share office. It was
Yeah.
for me like comfortable. Sometimes I regret, sometimes I don't, because there's always the good and the bad. You know how it is.
Of course, of course.
Being alone in this country without family, with two beautiful daughters that I have, and dentistry, it's just overwhelming. It's too many things going on. So it's good to have my husband taking care of my part, my practice too, if I'm not there, Like sometimes I'm traveling and he sees patients for me that is an emergency. Like he takes care of the patients too. Like he medicate the patient. He finds out what's
Okay.
happening.
I'm
They
thinking
tell
the
me.
doctors are doing root canals now.
No, no. Actually, I actually do everything. I do root canals, I do extractions, I
Yes,
do
yes, but
almost
he
everything.
can prescribe, which is a great way of having that little network of your own, involve your
Well,
medical physicians to help in that regard. Because I assume the way it helps your practice is you share the same patients for the most part, right?
yeah. Well, it is and it's not. Because some people, word of mouth, people come sometimes and they're not from my husband's
Okay.
practice either. But it's improving too, my dear. It's changing here, the
How
type
so?
of patients that we see.
Oh,
Yeah.
because of the dentistry you're getting into now. Is that what you mean?
Yeah,
Wonderful.
yeah. It's coming people from different places, and in the Brazilian community, we see pretty much Spanish speaking people. So here we speak
I see.
Spanish, English, and Portuguese. And my staff
Yeah, didn't
speaks
even know at all.
Spanish, English, and Portuguese. My staff is in the same page.
Yeah.
So that's why it was really always hard for me to find the good staff, to have a good team, because I needed people that speak three language all the time.
Right. Because the Chicago area is very diverse, correct? I mean, you have so many heritages and languages, I would assume, in your little area right there. So it's
Yes,
probably very
yeah,
important.
yes.
Um, Now, being somebody that came from Brazil, built your own practice in the States and in the heart of Chicago, what were the three key moments that you can say helped you in that regard, or in
Yes,
your
my dear.
career in general?
Yeah, one of the key moments was the boards, for sure. That was challenging for me, the language, and find out where I could get some help too in the beginning, because nobody would tell you. You would call the universities, they say, no, we don't take any foreign students. Or then I had to find out the hard way, like speaking here and there and asking questions. So finally I went to Northwestern, and then that's where I went through all the clinical part and took my boards.
Hello, I'm just taking a quick break from this podcast interview to tell you how you can get started with DSD. If there was anything that our guest has mentioned that strikes a chord with you, or you are curious about becoming a DSD clinic, I encourage you to book a call with me. This is a 30-minute, no-obligation information sharing session in which I can answer your questions about DSD and discuss your options based on your unique circumstances. The link to schedule a call with me can be found in the notes on this episode. Now, back to the interview.
The second moment that I have that was really interesting, after a certain time after I opened my office, I started reading about neurotoxin and Botox. At the time, that was the only one, and injectables. So I started reading about that, and I was interested to implement that in my office. But unfortunately, Chicago and Illinois wasn't approved yet to
I see.
practice that. So I had to take a course in Florida, and I started implementing this in my office after a certain time because I had to call the professional regulation to be able to open the doors
Wow.
for that in dentistry.
So you were one of
So
the
I-
first.
I
to
was
implement this.
I was, because when I called this guy in the professional regulation, after even the doctor that gave us the course in Miami, he told me, look, we're legal in Florida, California. You have to work with your friends, the dentist that you know that wants to work on this field. You have to go and work to open the doors. And that's what I did. When I came back to Chicago, I said, no, this is so good. I'm going to call and find out if I can, the status of this procedure in Illinois. And then he said, Dr. Reis, you're the first person to ask me this question. Can I go back to you later? I'm going to have to research, talk to some people, and call you back. And after a certain time, a couple of days, they called me and they said, you know what, you are on your own. If you feel confident with your knowledge, and if you think you are ready for any legal problem, they said that way, you just can go ahead and start. You're on your own. And I said, oh my God. I realized that I was one of the first ones to talk with this professional regulation. What I think it's great, because the oral facial results of our treatment, everything integrated, it's really interesting, it makes a big difference. Like if you have a gummy smile, you
Absolutely.
can fix it, and I think it's really good.
How did you feel in that moment? Because everyone wants to be the first or the best, right? And so you were one of the first in that, but you don't realize the risk that comes along with being the first.
I know,
So-
I know.
I
I know.
know.
I always like something new, I'm always looking for something new and something to implement that is going to help me have better results and things like that. Then I found it, what I'm going to lose, not, just going to ask. And then it happened. Everybody started in Brazil. I remember one day that I went to Brazil after I took that course. My sister, my friends, they wanted me to inject them. And I said, you know what, I can't, because here it's not legal, and Brazil wasn't even legal. But I did take a lot of courses on that area already. And with DSD and digital dentistry, my goals changed a little bit. So I'm not really, my focus in digital dentistry is stronger than in this field. This was just to complement. So
Absolutely. But it's important because it connects all the pieces for you too, right? If you see something and the tissues matter for the overall result of your
the
dentistry.
patients is asking for that one. People love cosmetic,
Yeah.
And the third change, like the 3 moments you asked, the third one was DSD in my life. And I'm passionate about DSD. You know how it is.
Yes.
I can't work without DSD. DSD for me gave me gave me confidence. It gave me, I feel good. I have my conscience free of problems because I have that wonderful multidisciplinary platform that I can
Right.
use every day with my patients. And that's a very nice tool to explain, to educate the patients,
Yeah.
and for them to see their end results even before we start treatment with the mock-up. It's so, so important.
Right. So, I mean, you've been involved with a lot of the firsts, right? You're the first Brazilian dentist in Chicago. You're one of the first to get into the Botox avenue of dentistry, and you're one of the first, honestly, to be involved with DSD too. I mean, your journey with us has been a long one.
Yeah.
Can you share with others, what it was like when you first were introduced to DSD and how it impacted your office, your dentistry?
Yes. Well, first time I encountered DSD was at my hometown. Do you believe? I went to Brazil and then I decided to take that course. There was DSD Day, the DSD Day.
Yes.
Then I said, I went there and I saw friends that I knew in Goiânia, dentists, and I had so much fun at the course. And it was so incredible the way they were showing the mock-up, how to do a mock-up, and show the patient their smile, their ideal smile, even before you start treatment. I said, this is a game changer. There's no way to get out of this. So that's how DSD impacted. The first time I saw DSD was like that.
Yeah, yeah, and now you're a DSD clinic, which,
I would never think that I would come that far, to tell the truth, because like you said, I thought my office being simple, it's not really as fancy as the other ones. And for me, was because I didn't stay out of my comfort zone. I wanted to stay close to my husband, being able to travel, those things, and
Yes.
comfortable. And being a doctor close to me, it's always good and safe.
Right, absolutely. We all wanna stay in that safe place, and if
And
it's oh, sorry, go ahead.
yeah, no, no, no. And when I came to this office here, this hospital built everything for us. So it was something that I could not say, no, I'm not going to go there.
Right.
They built the cabinets, they built the whole office. They invited us to come here
Yes, yes.
because my husband has a huge amount of patience for the
Right.
area.
So you had a great assistance into the launching of your own business, which
Yeah,
most people don't really have. Um,
that's true.
so, having all the resources that you did in the beginning, I would assume, honestly, I would assume that it would have been easier for you to become a DSD clinic sooner in your journey with us. However, knowing you, and I'll share with others that, I want to say, how many years have you been involved with DSD? Since when was the first course?
2018.
Wow, 2018. So being that long of a time frame that you started, and then you just became a DSD clinic within the last year, right? Not even a
Yeah.
year.
Mhm.
Besides staying in your comfort zone, is there anything else that you feel kept you, or is there any regrets that you didn't start sooner, maybe?
Yes, Maddie, I thought I wouldn't be able to be DSD clinic because I didn't uh, comply all the requirements of the clinic in my idea. You know,
Yeah.
I know it's not really how it shows. But it's important that you know the protocol. You know how the workflow. It's important to know what you're doing, but it's important to be able to welcome the patients the way we want it to welcome. And being together with my husband, staying reception, and I was kind of confused on that. I said, no way, I'm not gonna even try. I thought this way. And in my age, I didn't want to start over another
Yeah.
practice because it's a lot of I didn't want to. The reason that I kept working for more time, that I'm very excited and fascinated with this digital dentistry, And then I said, no way, I cannot stop. I have to go for it. I have to leave this dentistry that I always look for. I always look for something. I was always a technology person.
Yeah.
See, when I opened my practice, I bought patient education videos. I had Casey. You probably don't even know about it. Casey, they had different type of tapes with Portuguese and English and Spanish with all the procedures, explaining the procedure. So if I see a Spanish, because I had a problem with Spanish in the beginning. I didn't know that I was going to see so many Spanish people. I didn't know how to say, open your mouth.
Right.
So, I had to start with small words to be able to treat. And then I had to hire Spanish speaking staff.
Right. On top of everything else.
Assistant. So on top of everything else, after I finished school, after I could open my practice, I came to a place that I had to speak Spanish. I said, this is too much for me,
Yeah.
But what can I do? Then I started practicing and I said, I have to buy those things to help me, like intraoral camera, digital x-rays. I was one of the first ones to buy in my area because that was a game changer too. Digital dentistry. We used digital x-rays. We used to develop those things, and they were so hard.
Yeah, I remember the little aluminum.
Crazy. Yeah, it's crazy. And then when it came to digital, when they just see on the computer, the patient was like, wow. I was like, always that I could buy something that would help me. The tools is so important, guys.
Yeah.
It's just
like being open to it is the number one piece to that, right? And
yeah,
you were always.
I was. Sometimes I would say, my God, but this is so expensive. I might have to work a lot to pay this. But I said, this is worth it. I can't work without this. I don't care. My husband, I care what you're doing. Said, I don't care. This is the best thing. I'm going to go for it.
Yes, absolutely.
I'm always like this.
So how has things changed for you? Because like I mentioned, you've been with DSD for a while, and anybody can practice dentistry, just mainstream DSD. But how did it change for you once you became a DSD clinic? Because you were in that journey for a while until you officially
changed the way I see my patients from the beginning to the end. It makes my workflow so efficient, faster, predictable, and the results are whatever you see in the beginning, usually copy and paste dentistry. So I really enjoy that. I cannot work without DSD anymore because it guides me, It guides me how I work, and I can relax. I don't have that issue that be sending patients to different specialists like I used to in the past. I would send them to the perio for gum surgery, then I would send them for it. I do a lot of extractions, but I kind of try to send to make it easy for me some extractions and second opinion. It's always good I'm very alone here, I'm a solo practice, so I have to use, especially when it's time to. Sometimes you really have to think, this is for a specialist. I think we need something better here, more knowledge than me. And it's true. You have to know when it's time to stop, to refer patients, okay?
Right.
So now, if that I'm working with DSD, I feel like I'm more covered. I have all the interdisciplinary approach there,
Yeah, absolutely.
So it's a game changer. It's really, people say that it's expensive, but I don't feel that way. It's worth it.
Right.
Do the planning. At least the planning guide you through with all the steps that you need, and the patient's on the same page. They can see better. They can have a better education about their situation. So there's no way. For me, I can't. I don't know how people do, but I think DSD is the must.
Yes. And just to touch on that more, I think, you can do your dentistry without DSD, right? However, like you said, the statement of it being expensive, it's what's expensive to that person, right? Is it the value of your time and your energy and the patient's happiness and overall outcome and everything else that comes alongside your dentistry that you don't necessarily put a monetary value on. I would say that that's how DSD clinics helps you overall because it's not just about the case itself. Like you can find a designer, you can find a lab, right?
Of
But
course,
how
but it's the platform, the
right,
interdisciplinary platform, especially when you do implants and you have surgery involved. It makes a big difference, Maria. You can sleep better.
that's exactly
I
it. Yeah.
think so. And
I
of
think so too.
course, it's a team effort too. You have to rely with your staff, you know, and and be together on the same page. So that's
Absolutely.
where the coaching helps. The
Yeah, tell me about
coaching
that.
really helped my staff to get on the same page and understand the system better and help me
Good.
better. Because in the beginning, Maria, I was so stressed to be able to implement that DSD in my practice was a nightmare. I'm not gonna lie. So I had to figure out the platform. I had to figure out things, and the assistant was getting tired of it. I lost some assistants. Then it came COVID. I lost some assistants, and I don't work without assistants. I don't have another doctor, but I do have a lot of assistants. Like they make things easier for me before I come.
Right.
Like X-rays is done, the scan is done, everything, paperwork and everything. Then it's photos, So
Yes.
they need to know. So if they don't follow the protocol, so you're screwed up. Then you
Right. And
come,
and
you
it's
lost time. You have
it
to
is
be
not
asking.
just about teaching though, right? Because you're a great teacher. You have so much knowledge under your belt, so many CEs and so much experience. And I know that you can teach DSD to anyone, really. You're one of us at this point. You could be part of the DSD team with all the courses you've been to.
Oh, I love the family. I'm telling you, I would be glad to help.
But I just thought it was so interesting that you mentioned the coaching.
And I don't pay me. I was afraid that I wouldn't be able to pay that because we don't know.
Yeah.
Too many
Yeah.
things going on. And I'm
Right.
trying to slow my dentistry like more. I'm already a slow dentistry person.
Yes. Yes.
You know how I am. I like to educate. I like to explain. I like to take my time with my patient and a good relationship with the patient. That's the difference of private practice comparing with corporate practice too. It makes a big difference. And I don't know. It's just,
How's it been though for you? What about the coaching has affected you the most?
Maria, I am happy and relaxed
Oh,
a lot more, I would say. But it took away of my back 50%, the heavy stuff.
wow.
So I'm impressed actually. The girls, I know they're still learning. They're not,
Yeah, you're still
um,
in it. Yeah.
I have different stage of assistance here. Some of them never heard that before. They just went to your course, not a coordinator course that I think it helps a lot too. That's when they really get it serious.
Right.
The coaching was great. Push us, push. You have to do your tax. You have to do your tax. You have to do this. And then we have to talk to each other. We have meetings. That makes a big difference and then they tell things that they shouldn't tell, but it's good because then
A little
we
therapy.
open our eyes like, oh my God, did I do that? Do I do that? Yeah, it's
Yeah.
interesting. It's really good. It helps a lot. Really,
Absolutely.
it really does.
Yeah, it's important for all of us, really, not just in DC, but in general, right? To check ourselves from time to time and say, are we really as good as we can be? And I think that you nailed that with your team. They're constantly involved and that shows through good leadership. So just had to slip a little compliment in there.
Ay, Mari.
Um, so let's see here. You have the medical situation. Is there anything unique about your office that you want to share in that regard? What's helped you in your business mainly?
Well, to tell you the truth, unique that sets the DSD sets us apart from any other clinic. That's for sure. Being the first DSD clinic in Chicago, for me, it's an honor.
I'm gonna get you a shirt that just says the first because I think
first.
it's your overall title now, the first and everything.
The first DSD. Can you believe this? I didn't know I was gonna be the first. I was already expecting somebody to start. And I looked like I had to be the first because I gave them a lot of time to find somebody here.
Right. But part of the process, is that you have to qualify for the certification, right? We don't allow just anyone to be a DSD clinic. So you, I know it seems like you gave a lot of time, but really you were ahead of a lot of people just in your knowledge alone of how to do the DSD protocols and how to do the workflow with us. And so even as you're not being a DSD clinic, you were still doing the things that a DSD clinic would, right? But I think the main difference there is that you didn't really have the assistance from us. It was like taking all the knowledge and trying to figure it out
I
on
had
your
problem
own.
with my stuff. I lost 2 good stuffs at the COVID time, and then the other ones were new. And it's hard to find stuff right away like this and teach them this different thing. People come, they want to relax. They don't, you know how it is hard. I don't want to
Absolutely.
talk about that. See, that's the hardest part in dentistry. They don't teach us how to manage the staff team and not to manage the business when you're in school. I had to learn on the hard way, like alone.
Yeah.
It's not about the clinical skills, not about just the clinical skills. You have to learn business.
Yeah.
Otherwise, you screwed up. And I was crazy enough to open my own clinic when I finished school, and I didn't even speak Spanish and English that great.
Right.
And I had to learn all the terms, all the words in English, all the instruments. I had to teach all my staff everything. It's been like a great journey.
Yeah, and it's never ending,
much.
right? It's always evolving.
Yeah.
But that's a very, very common concern for a lot of practices is the team itself. And I've talked to your girls, I've met them at courses. They're so amazing, and I see the relationship you guys have with each other. Will you share with the audience what you have learned in your experience with hiring and finding the right team members? Just what that process has been like.
No, man, that is, you asked me the hardest thing in my life to find stuff. I was about to quit my profession because I was afraid. I was tired of teaching. Honestly,
Right.
the only thing that made me stay still, and keep up with the dentistry was the digital dentistry because I was tired. I said, no way. If I lost everybody, and then there's this issue of the girls. Sometimes they get pregnant and they have to leave. It has been hard, staff issues, but I cannot complain. I'm very proud of my staff, and they are a great support right now.
Yeah.
And they're trying the best, and I'm very happy with the team that I have right now. Thank God.
Right.
Thank God I got things settled.
Yeah. Yeah.
But it's
When
not easy to teach. You have to spend time. You have to just let them do it.
To let go a
Make
little.
mistakes.
Mhm.
Make mistakes, and then look what you did. This is not like this. This is like this. So next time, please do this. So it's gonna happen this if you're teaching your stuff.
Yeah.
Because we even do mistakes too. So it's like this. You have to be
Absolutely.
patient, take your time, and keep having your goal, If
Yeah.
you want to go somewhere, you have to keep
Absolutely.
fighting.
And have that support around you, like you mentioned, and I didn't mean for this to be all about DSD, but DSD is a huge part, I think, for your business today. and really your whole pathway in your career. You mentioned that being part of DSD was one of the things that got you through those tough moments. Can you explain how exactly we helped in that?
Tough moments? How? What are you talking about?
With the team, you said that, in those moments where maybe you're losing your team members to pregnancies and being out of the office, but you kept going because DSD got you through those moments.
Yes, it's because I love DSD, Maddie. I got fascinated with DSD. That was in my vein. That was the only way that I could survive
Yeah.
after I lost my some of my teams,
Right.
some
I-
of my stuff.
I do hear a lot how DSD helps in the meaningful relationships. That's one of our core outcomes that we strive for. And I've seen it firsthand how we come in and the team itself, the whole attitude kind of changes, and in the just that uplifting feeling of excitement. And I'm trying to think, in your situation where maybe you lose your DSD coordinator in the moment and you have a DSD case come in.
Problem too. That's good that you mentioned. That for me was overwhelming too, because that was the one that I was more close to it, business wise. And then it comes the business. The problem, the business. And I'm always alone trying to produce, trying to work and make things flow,
Right.
And then suddenly she didn't tell me. She just roofed. When I came from my vacation, she was working someplace else. So that was for me devastating. But you have to go. You have to keep going, I just said, well, I have two choices. Forget about this or
Right.
go for it. But I couldn't. I just liked the DSD so much. And I had the other staff member that I been with, Tanya, that she's really nice and she always helped me so much. We've been taking so many courses together. We did Smile Design with the Smile 5. We did a coordinator course too together. We went to a lot of things, pinhole surgeries. So she's really
Involved.
she's my friend actually. I like her a lot.
I can see that.
Yes, I like her a lot. And what happened is that we are together. No, Dr. Reese, we're going to do it. No, doctors, I'll help you. No. But then she's there in a chair and I'm there in a chair. No, I help you. It's really hard to be outside of your chair, dealing with managing things. Then thank God I got back one of my managers from the past, Gloucester, and she started, but it was so different. She was, oh my God, what's going on here? It's not the office that I worked
And then you
before.
train again. Yeah.
Then I had to send her to the DSD coordinator because she's great too. She's helping me a lot with all the paperwork and financial things that she understands more. So things, it looks like a puzzle. Bloofed, everything started working and praying. That's, I think it helps too. Asking for more good energy, especially when you're treating patients for the first time. You ask, it's like praying for a good result. So that's the way I am. I do. Every time I start with a new procedure, I ask for good energy, mindset, I need
Focus.
and focus, in the
'Cause I
best dental care for the patient.
Absolutely. I think it's so easy to well, it's human nature, right? To focus on the bad that's in our way right now. And I want to say, as a DSD clinic, you have all the pieces in place, but life happens, right? And it's going to happen again. And there's going to be people coming in and out of your office, or pregnancies or breaks, or who knows, COVID again.
You don't own your stuff. You have to accept. But you just get kind of, oh my God, what did happen with me all the time?
Yes. And so it's easy to get in that negative mindset sometimes, right?
Yeah.
And I want to say that DSD helps because of the workflow. It almost forces you to focus on the patient, right? Which is what we all do naturally anyways.
It's a patient-centric care. It's
Exactly.
patient. So you take your time with the patient, no matter how long it's going to take.
Right.
So that's the difference of my practice now. Before, everything
Wonderful.
was like a production. Now it's quality.
Right. Regardless of what's happening
The
around you,
focus
right?
is different. We have to, but in the past, even in the past, I was a little bit like slow dentistry too, because I always wanted to explain the patient, be on the same page, in good relationship with the patient, to be able to work together. Because if the
Mhm.
mindset of the patient is not good, how you can, if they don't rely on you and they don't trust you, how they're gonna relax and
Right. Right.
and let you do the work. So it's important to have both patient and doctor in the same page too. I
Absolutely.
think so.
Absolutely. And that's, I think that's one of the most beautiful things about it is, and you're the greatest example of it is being so dedicated to your beliefs in patient-centered care that, when life happens and you lose a team member or your coordinator in the moment, you're so hyper focused on what's most important. And so that gets you through the procedure, that gets you through the day and gets you through life in dentistry, because it's normal. We're all gonna have hiccups along the way. We're all gonna
Yeah.
have,
Yeah.
right? Things,
Important thing is to follow your protocol.
right.
Dentistry, you cannot skip a step. If
Yeah.
you skip a step, you're in trouble. Follow the protocol step by step. Try
That's
to be less invasive. Use
yeah.
more guided dentistry. You have to. Is there anything better than that? No. I really
How did you know what protocol to go with though? Because I think that there's so many in dentistry. I mean, and one's not right or wrong. It's just what fits you, right? So, how did you know when you first went to DSD Day, like what was it that clicked for you? That was like, this is the road I want to go down.
It gave me love in dentistry again, Maria. It was like, oh my God, it looks like you painted that your profession. You gave colors to my profession. Different approach. It was not that routine thing. So I love that the way that the DSD present the cases and do the treatment planning. It's a lot easier. It's an educational too. It's a lot easier to get results and to get financially too, to get the patient accept the treatment.
Right.
You sell the treatment a lot easier if you know how to do the step-by-step thing.
Yeah. Or not at
And
all, really, right? You do what you love best and the case
no,
almost
that's
does
the
itself, right?
thing. When you love what you're doing, when you feel that, you know,
Yeah.
that up like this, I know how to do this. I know that's gonna give you a result. You're confident. There's nothing that can change this. When you don't know what to say, what to show, what to explain, where to start, then you lose.
Yeah.
You
Yeah.
lose the game completely. Completely.
It helps that communication piece tremendously, right? It's because there's so many dentists out there that I see that are like, "Oh, I don't need any assistance in selling my treatment. My patients accept all the time." But
No, people
too, right?
people come with their ideas already. Could be from another office, or because their budget doesn't match, or because they think, no, I'm happy with my smile. I don't care about those crooked teeth. They don't have any idea. That's orthodontic treatment. It's not only cosmetic, Maria. It's still like the malfunction, the malocclusion. It affects 50% of the global population.
Yeah.
It's a lot, and people don't realize how important, how that is going to affect their overall oral
Mhm.
health.
And DSC takes away the component that you have to tell people what to see, right? It's more visual,
It's
communication.
visual, and
You
that's
don't
what
have
I
to.
always love.
Right.
Remember, I told you in the beginning of my profession, I would put tapes,
Mhm.
But things change. What I'm gonna show now? Tapes, nobody's gonna see.
Listen to
People,
this
there's
tape.
so many things in Google. People already come with the everything. They Google everything. They
Yes.
come with the diagnose. Oh,
Yeah.
I have this, and this. And I said, oh my God, when am I gonna go to explain that that's not the exactly situation?
How do you handle that situation when the patients come in with their diagnosis? They're like, "This is what's wrong with
Well,
me."
I don't change my ethics. I have, like I said, I have my protocol, and I try to explain them, to show them different
Exactly.
cases. Because the good thing is now I have already cases that I reported from the beginning
Yeah.
and to the end. Then I show here, look, and we have good tools. We have the scanning, the iTero that helps educate the patient a lot with the time lapse, with the cracks of the teeth and things like that, and that's the simulation for you. Then you can start. Every time you see a row of teeth problems, you know you're gonna get in trouble with that conversation, because then now my teeth is good. I did Invisalign. They're aligned. They're aligned. Then you see the canine that's not. It's not really touching, and it's broken. And you see,
Right.
oh my God, and they want you to do 1 tooth there. You have just to tell the truth. Look, if I do that, it's gonna continue ruining your entire mouth.
Right.
So I agree. It could be a little bit too much for you right now, but we can do transitional work.
Yep.
We can do transitional work, and we can later on start changing little by quadrants, and then it's gonna be more comfortable for you.
And the
But it's
visuals
really
that you
hard.
use.
It's really hard. They think everything's cosmetic, and it's hard to sell. It's not easy. But I feel like if you have the best tools, and if you have the right technology, and the right treatment plan, okay, so that's important. You can teach the patients. That's why you need time with patients.
Right.
There's no way that you need this. People
Yeah.
are searching. People are searching, Googling. It's whatever they see beautiful stuff, they go. They think in aesthetics all the time.
Right.
Everything is aesthetic.
Perception is reality, right? It's what they want to believe, and it's so challenging. I mean, not even in dentistry, but in life to to convince someone on
Yeah, with all
anything. But
the filters that we have, and
Right.
all the digital enhancements that we have, it's they think that's possible. Standard of
Communication.
perfection.
Yeah. Right. It's a challenge. But yeah, I love that you brought it up, how the visual communication aspect and having the planning center from DSD help you in regards to the treatment. That's one thing
That is the
less that you have to
I think it is. I have to admit that is over. I can't work without it. It's just easy to explain, Maddie.
Yeah,
And
absolutely.
and I love seeing my work finished. The new smiles, the results of our patient's smile.
Yeah.
Especially the mock-up sometimes too. It's so emotional, and that you can put the beginning, the final smile, the ideal smile in the beginning before you even start your treatment. That for me, game changer too.
Yeah, get better. Yeah.
No, you
Yeah.
can't grow better.
Well, I can talk to you forever, Raquel.
we
You're
can
like
talk.
the ultimate girl's girl. I just love talking to you. But we're running out of time, and we're doing something new now in the Small Business Diaries podcast where we're asking a question.
Yeah,
with-
no, I didn't send you that. I can tell you.
No worries, no worries. I'm gonna ask you a question from a previous guest so we have a connecting element to each podcast. I want to ask you, and it's honestly a perfect question for you because it's DSC related, from another DSC clinic. He wants to know, how do you attract more DSC patients to your office?
Okay, well, we're using the media, no? We're trying to improve our Instagram and Facebook. And I actually, with this coaching, I was able to improve a lot of stuff, even my bio. I made a guide showing our office, explaining about our office. And we are going to do a video now saying how we work from the first visit to the second, and the final. So I think you have to do those things because we have to take advantage of the media nowadays. That's the only way, Maria, or word of mouth. People that already came. I attract patients by showing my cases too. When you start having cases done, oh my God, that makes a big difference because you get your iPad and here, look, that's what we're doing. We see the patient the first time. We welcome you to our clinic, or we get a good relationship with the patient, first, and then we take photos, we do a video, we explain why we do it. We integrate the face with your smile. We integrate oral way. We help you breathe better. And I just did a course that was amazing too in how to open the maxilla expanders with Dr. Mandalaris here in Chicago and Dr. E. That was really, it's a lot of things going on.
Yeah.
There's too many things that it's going to improve dentistry, and digital dentistry is just going to continue. It's here as a reality, but it's going to just continue evolving and evolving. It's not going to change. So that's...
Yeah, I think one of the parts to that too that not many think about is, in the beginning you may have to attract, right? And you do your first few cases, but now that you have your portfolio set up, the thing is that you don't really have to look for the DSD patients at this point. They find you, right? And that's the position that you want to be in. And it sounds like exactly what you're setting up right now.
In the beginning, you have to explain a lot.
Absolutely.
You have to
create the content.
Change the system with the old patients. It's hard, right? They're used to one system, and then suddenly you're telling different stories.
Yeah.
So and then I have to say I didn't have this tool before, or now I have, where I didn't have that knowledge. I took some extra course. Those things, it's complicated to change, and it was a big change.
It's an opportunity, really, to introduce something new to your patients, right? And then that
is a good opportunity too. It means we evolve. We are
absolutely,
and people like that on me. They say, "I like you, Dr. Reed, because you're always doing more and more and more. A lot of continued education. I always come here and there's something different. You're always upgraded.
Yeah,
up to date."
That's a great definition of you. You upgrade every day. I love it. Good job. You do. The first. That's Raquel Reis.
That's crazy, isn't it? I didn't know there was gonna happen that with me. When I came to Chicago, I didn't even know that was the first dentist here. Like there was a guy dentist, but now there's a lot of dentists. But before it was just me as a dentist.
Wow. In there.
Complicated. Yeah.
Oh my gosh. Well, it's so wonderful to learn all this about you, just seeing the consistencies of your character throughout your journey and how far you've come, being a new immigrant dentist from Brazil, it's the American dream.
Coming from where I came.
Yeah, that's not easy. So thank you so much for sharing all that.
No, I've listened to your podcast. You're nice. I like to listen when I'm driving.
Absolutely. Education never ends, right? It
does. I love to learn. I love to learn.
Thank you so much for sharing.
Thank you, Maya. It was great to talk to you.